Today we are here to discuss yet another full mouth dental implant rehabilitation case. This patient came with a complaint of a decreased self-esteem and an inefficiency to chew his food normally. These two were his major complaints, and a full mouth dental rehabilitation treatment plan was suggested to him. Upon examination, this patient reported a declining aesthetic nature of his teeth. There were gum recessions, there was mobility with his teeth, and patient was extremely unhappy with his smile. He was extremely self-conscious when he was interacting with other people. So we decided to go for an all-on-6 approach for this patient. For this approach and execution, a team was formed. All of them with a combined effort executed this case. Once the patient came in, the 3D scans were made, the 3D digital guide was made for this patient, and then the surgery was executed on the day of surgery. Not to mention, a cardiovascular clearance from his cardiologist was also taken, as a patient had severely compromised systemic condition. Once the clearance from the cardiologist was obtained, the surgery was executed and post-surgical aftercare instructions were imparted to the patient along with the medications that needs to be followed. Once the initial healing was achieved, that took around 1 to 2 weeks of time, the patient was given a provisional or an interim prosthesis. This interim prosthesis was made by recording 3D digital scans of the implant that were precisely placed into his mouth. After 3 to 6 months, a fabrication of a permanent prosthesis is done. This wait of 3 to 6 months allows the implant to integrate with the jawbone of the patient. The transformation for this patient was life-changing. The patient was ecstatic and reported a boost in his confidence and the quality of his life. Not only was his masticatory function restored, but also a healthy smile was restored for him. The initial digital planning ensures the success of this case. The virtual planning leads to the optimal result that is expected out of the case. The planning plays a very crucial role into any case that has been executed as a full mouth dental implant rehabilitation.